Pastors Chooks and Toyin Ogoye. Pastors Chooks and Toyin Ogoye are the lead pastors of Resurrection Life Church, Johannesburg, South Africa. They are passionate about building families and raising men and women who transform and uplift the standard of life in their communities through understanding and applying biblical principles. Pastor Chooks and Pastor Toyin frequently host workshops, seminars, and conferences for transformation. Some of their programs include Kingdom Financiers Conferences, Dream Achievers Conferences, Marriage Enrichment Courses and Seminars, for wives-only seminars, Single Ladies Boot Camps, and Limitless Men Seminars. They are the founders of the Power of Women Academy, a group mentorship for high-impact women, and host the annual Power of Women conferences and Amazing Power of Women broadcasts. For more information, please visit www.idelight.co.za and www.reslife.org.za or WhatsApp +27 814 210 835.
Evening and a warm welcome to you for another episode of the Amazing Power of Woman. Every Thursday at 7 p.m. South African time, we are here discussing various things. I am Pastor Toyin Ogoye, and with me is Pastor Chooks Ugoye. Please say something, greet our people.
Hello everyone. Hello everyone. Dr. Goya here.
Yes.
I welcome you all to another evening, exciting evening of the Amazing Power Woman broadcast. Tonight is the last Thursday of the month, when we do Ask Your Gynae. By the way, for those who do not know about our show, I wrote this book, The Amazing Power Woman book, a couple of years ago. It's now getting to 7 years. I wrote this book. And this book talks about the power that God has given to women. And we realize that that power is in 3 dimensions, in her spirit, in her soul, and in her body. And this show is about ministering to all the 3 dimensions, her spirit, her soul, and her body. So once a month, we bring in a specialist gynecologist to help explore a topic that has to do with the body of the woman. And tonight is another night of Ask Your Gynae, and we have our resident gynae, Dr. Audrey Gugugamedze, just waiting on the flanks to hit the show tonight with an amazing, amazing teaching that she has for us. What's she talking about tonight?
Okay, we have, like what we usually do at the last Thursday of the month, like we've already explained, is the Ask Your Gynae. And what we usually want to achieve is just to bring knowledge, information around her body, around the female body, so that you understand what it is, the earth suit that we've been given, and how to function appropriately in it, how to take care of it, how to understand the way it works. And we usually would have Dr. Gamete, who would come, and she will be able to explore and explain to us exactly how that happens. And today, she's talking about discharges, just things around that. Every woman goes through one form of discharge or the other, something around their body. And so she just wants to explain, she will be explaining and giving us understanding around that, what is okay, what is not okay, what should you seek attention, what can you even actually take care of, take care of by yourself, just knowing what it is and understanding what it is. So we would have her.
All right, so we're going to bring Dr. Gamedze shortly. Dr. Gamedze is a practicing obstetrician and a gynecologist here in Johannesburg, and she's been on our team for 4 or 5 years now, bringing knowledge, insight, understanding, expert counsel for all the women out there. This is your moment to share the link with some sister, with some friends, some women that you know, because what is going to be discussed tonight affects all women. All women know what we're talking about. So let's bring Dr. Gameze.
Sorry, just before we bring her on, something you just said reminded me of something. We are going into the month, Women's Month in August from the next few days, and we usually have our annual Power of Woman conference.
That's right.
Annual Power of Woman conference is coming, but we're having it this time Usually we have it around the Women's Day, which is August 9th, but we're having it on the 27th of August. On the 27th
Mark
of
that
August.
date. Mark
Keep
that
date, and you will get information from us. Keep on our Facebook page. You will hear about it, and so you can register. We're going to be having free medical tests. That's actually what reminded me about it. Free medical test on that day. So for any woman, as we are having this program once a month and we're talking about the body, we also make that opportunity available at our conference for people to just come around and, you know, be able to take some of the tests that are necessary. So please mark that date.
So we do have Dr. Gamedze again
leading
a team of
team,
doctors.
Yes.
We recruited a number of doctors and specialists to join the medical team to offer medical help to as many women as would avail themselves. So this is your opportunity. Tell some sister, tell some friend, tell some brother, not brothers, no. Tell anybody around you who is a woman about the conference, 27th of August. We are on for the conference. It's a Saturday, and it's going to be live and online. So we're doing hybrid. So people around the world will join online. People in Johannesburg will travel and come.
You need to come and there and
be part of the conference. So
we will tell you maybe a bit more when Dr. Gamedze is done today. So we will tell you a bit more, but you just keep notes. I mean, diarize that day, Saturday, August 27th. It's going to be happening. We're going to be celebrating.
All right, let's bring Dr. Gamedze.
Amen.
All right, Doctor, are you ready? All right, please welcome to tonight's show, Dr. Gugu Gamedze, as she takes us on for another Ask Your Gynae session. Doctor, over to you.
Dr. Audrey Gugu Gamedze. Dr. Audrey Gugu Gamedze is a medical doctor by profession, a specialist consultant in obstetrics and gynecology. She runs her own private practice where she helps and serves women from all walks of life on a daily basis. She has a heart for women because she identifies, by virtue of being a woman, a sister, a mother, a wife, a daughter-in-law, and understands the journey of a woman and is still passionate about wanting to learn more about women. She is a born-again Christian medical practitioner. She sees her medical practice as a powerful ministry platform, an opportunity to touch and transform the lives of women and their families to the glory of God. Dr. Gamedze features monthly on our Ask Your Gynae show at the Amazing Power of Woman broadcast, where she helps women understand the female body and how to care for it. She's the mother of 2 children and has been married for over 22 years.
Good evening again to our viewers and listeners on the Amazing Power of Woman, and a wonderful, wonderful word of gratitude to my hosts, Pastor Chooks and Pastor Toyin. Thank you very much, my pastors, for allowing me this opportunity again to be with the amazing ladies, and we explore our womanhood and how we can strengthen each other health-wise. We are just going to continue and flow again around infections and vaginal discharges. We had a good time discussing the possibilities of infections and what it could be. Let's just dive deeper this time and see how much we can cover in the space that we have, in the time that we have. So vaginal discharges, again, can be a natural phenomena, like we discussed the last time, that wherever you are on your menstrual cycle, you will have a certain discharge that will define the space on your menstrual cycle. Before the period, you can have a discharge that is somehow milky in color, non-offensive, and also it will be of a uniform color, if I were to put that. Then very close to ovulation, the color will be clear and it will be sticky, still non-offensive. It will be transparent. And then close to menstruation, you can start off with a brown vaginal discharge, which can then intensify into the menstrual flow. I've heard something interesting, some ladies saying that they can smell the smell of blood close towards menstruation. I feel that it goes with how much of a sensitive nose you are. I'm very much happy that as ladies, we do keep track of how the discharge looks like so that we can pick up if there is an infection. So let's try and look at in our cycle, when is the highest time when you can get an infection, and how do those infections come about? Or when can you say that you have an infection? Sometimes you find that food that you have eaten, the last time we mentioned food like the cabbage family, it can come very strong in your vaginal discharge. Food like onion and the garlic, or all those onion family, it can come very strong in your vaginal discharge. That will not be a sign of an infection. So let's just run through common infections that we see every day, and that can give us an offensive discharge. Vaginal vaginosis, or bacterial vaginosis, or vaginosis bacteria, depending on where you come from. It is a very, very common offensive discharge that we see. Some of us think that it is sexually transmitted. I have learned in my practice to be very stingy with that word, because it destroys families, the very families that we're trying to build. If your partner has not done anything, he will say that it's you, and you will think that it's him, and we live a life of distrust. So let's just say that if there is any imbalance in the colonies that stay inside the vagina, that will be the bacteria and the fungus. If there is a trip in that balance, you are likely to have the vaginosis. Vaginosis smells more like a fishy odor, or some rat that died inside there. So what do you do in that situation? Don't panic. Sometimes it will be around a certain time on your cycle, but sometimes it may warrant treatment. And oftentimes you do need treatment. So please see your gynecologist to get treatment around that. Does your partner need to be treated? I would say yes and no. Sometimes, or oftentimes, it's very difficult to get medication to give to your partner. So if you can be treated, get the treatment and keep the treatment at home. And during the time of treatment, please use a condom. It just helps that you don't keep on exchanging the germs that are prevalent during the time of the infection. It is also a common information that you will get when you do your pap smear. So all they do during the pap smear, they will look at the colonies, the distribution. So if they mention bacterial vaginosis, you just get treatment. Sometimes you can even get it over the counter. It is called Metrogel V. It doesn't need a prescription. You can get it over the counter. You get to the pharmacist, you tell them that it smells fishy. They'll give you that treatment and it works. Sometimes you can even get a small test kit from over the counter at Clicks or Discam or any of your pharmacies, and you can do a self-test. From that self-test, you get the medication and you do the treatment. The danger of bacterial vaginosis, if it goes untreated, especially around the first trimester of pregnancy, it can irritate your cervix and result in it opening, and you go into preterm labor or a miscarriage. So let's make sure that if we are planning a conception, we check around that kind of an infection. The second common infection that gives a woman an unpleasant discharge is thrush. That is a yeast infection. Yeast infection is very, very stubborn. So that one happens now when the germs, which is the bacteria, they go down and the yeast or the fungus goes up. So that one will give you a curdy discharge. It normally looks like feta cheese. In medicine, we like to compare things to food. It just makes nice, good sense. We compare with something that we know. So it will look like feta cheese or like cottage cheese. And sometimes you can see that, feta cheese stays in some fluid. You can see that fluid leaking out. And usually it burns the outside of the vulva. It will be very itchy. If you wear your panty liner longer, it will start even getting into your fold of your groins. And it gets very, 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 very inflammatory, excoriated. And the temptation is that when you are washing, you just wipe even harder. And when you wipe even harder, it gets redder and much more itchy. Then it makes intercourse very, very uncomfortable. It feels like the vagina has narrowed. And when you are intimate, you stretch, and that stretching results in some cuts like excoriations. So that is very, very uncomfortable. It is a very common discharge in pregnancy. It is a very common discharge if you are diabetic. It is a very common discharge if you have an immunosuppressive disease. So sometimes you think that is sexually transmitted. It is not sexually transmitted, but during intercourse, you can transmit now resistant strains. Resistant strains are the ones that are difficult to treat. So if you get recurrence of the thrush, please make sure that you see your doctor. They will do what we call a culture and sensitivity and select the best treatment that is going to help eradicate it. We spoke the last time about finding clothes that will help you as a woman have a rebreather. So that will be cotton wear. You can use cotton wear, avoid panty liners. If you do use a panty liner, make sure that you change it frequently. But the important thing I want to highlight this time is that it can be so recurrent that you feel that maybe somebody must tell you that you've got diabetes. Somebody must tell you that you've got an immunosuppressive disease other than diabetes. So it is important that you check also your status as a woman so that you can be given complete care. The other discharge that is common is caused by HPV. HPV is a virus now, it's not a bacteria. So this one, it is also exchangeable during intimacy. With males, it stays as part of their normal flora. With the females, when it gets to the female, it then disorganizes the cells in the cervix. When the cells in the cervix are disorganized, your cervix can have what we call a cervicitis. With the cervicitis, you get inflammation because the bacteria, the virus is trying to dig or burrow deeper into the inner lining of the cervix, where now it's going to cause its babies to grow through the entire lining of the womb. So if the cervicitis happen now, you find that the tissue that is normally inside the womb comes out. So some women who like to read, they'll find out that it is actually widening of the transformation zone. So the mucus part of your cervix comes on the outside. That will give you an excessive discharge. That excessive discharge can be mucoid. If you get a superimposed infection, it will be a little bit offensive. So HPV can result in a cervicitis. So how do you know whether you've got HPV or not? So what we will do is that during the time we do a pap smear, we will also check or test for HPV. HPV 16, 18, 45, Group A and B are the ones that are implicated in a cervicitis that will later on predispose you to cancer of the cervix. So with that, you need your gynae to do a camera assessment. That camera assessment is called a colposcopy. And then the doctor gets to peel off that abnormal part on the cervix. That is usually both diagnostic and curative. When I say diagnostic, it means that from that tissue, they can check how far spread or how much was the change or how extensive was the change. So, and from that, they can see also that from the cut that has been done, has it included everything that was affected or part of the margins were not completely excised. Then there is another type of HPV which will now give you warts. The warts can be on the outside of the vagina. The warts can be on the inside of the vagina. If they are inside, they will cause excessive secretion. So your discharge will also be a little bit higher. You are less likely to be offensive unless there is a superimposed infection. But when you digitate, you will feel that there is excessive roughness. And if it's growing on the outside now, growing on the vulva, you will see like cauliflower or broccoli-like growth on the outside. And that can be easily bruised by an underwear, giving an offensive discharge or an offensive odor when you pat your legs. So that is important to report to your healthcare provider, who will institute treatment. That can be treated in two different ways. We can be conservative, that is just get medication and treat it. That medication can be applied on certain days of the week, and it will have to be washed. Usually there is strict instructions on how you can do it, because it is only effective on the rapidly dividing tissue that has the virus. If it goes on to healthy skin, it's usually very poisonous to that skin. You can sustain some chemical injuries. Then, if it is extensive, we can take you to theater and cut off or burn off the affected part. That is called cauterization of warts. So that is usually curative and also diagnostic. Whilst I'm on the warts, may I please emphasize that if your warts are recurrent, that is, you've treated them, but they keep coming back, or you have treated them, but the part where it's been treated, it remains itchy or it remains discoloring, please make sure that you go back to the doctor. We do a biopsy so that we check now the treated skin, has it not changed to be cancerous, which is always a possibility, or almost always a possibility with people who have got skin diseases or people who are immunosuppressed. So my dear sisters who are on immunosupportive therapy, that could be for diabetes, that could be for sclerosing diseases, that could be HIV, please make sure that when you've got warts that are changing color, warts that are resistant, and warts that are changing even personality or characteristics, you report that to your gynae or to your primary health caregiver so that we can do a biopsy. Biopsy can be done by a dermatologist. It can be done by a gynecologist. That will help us now to know whether there are any changes which can predispose you to cancer of the vulva. Wow, that was extensive, but yes. And then the other thing that can give a woman a discharge, it is if you have had a miscarriage and the miscarriage was partially treated, or you thought that because the baby is out, I can hide from my family that I've had a pregnancy, or you went to some street somewhere and they offered you treatment, what we call backstreet abortion. If that happens and it goes untreated, you will have a discharge which can start off being bloody. And then if it is left untreated, it can sort of try and resolve, but you'll have this offensive or strong odor of something that has died. Most of my patients will say it smells like a rat died inside me, doctor. So if that has happened, please seek urgent medical attention. A partially treated miscarriage is as dangerous as a miscarriage that has happened and the womb has gone rotten. So please, my dear sisters, if after a miscarriage, even if you've been to the hospital, Dr. Gamete herself treated you for that miscarriage, but after that you still feel that there is a smell that is coming out, please make sure that you return or if you are uncomfortable going back to the same practitioner, you look for somebody else and you do say that I've had a miscarriage or I've done an abortion. This is the situation. It is smelly. There is a discharge. That can be treated. From my own personal experiences, I have even found sometimes you find that when the baby was pulled out, the parts of the baby remained inside. I will not mention what, but parts of the baby have remained inside. That can cause sepsis or infections or rotting of the tissue. So please make sure, my dear sisters, that after a miscarriage, you do seek medical attention. That is very, very important. So all these discharges that we have mentioned so far, they can also result in what we call a bladder infection, urinary tract infection. Urinary tract starts from the vagina. In the case of a woman, the woman has an encasement. That encasement encases both the urethra, where the urine comes out, and it encases the vagina, where babies come out or where intimacy happens. So that goes in one case. So if there is an infection in the vagina, it is most likely to affect the urethra. If there is an infection, maybe based on the hygiene, like say on sometimes when you wipe the vagina or when you wipe the anal area, you bring towards the front. So all those germs are gonna move from the anal area, come up to the vagina and come up to the urethra. So if you have a recurrent bladder infection, please do check if you do not have an infection in the vagina. That is very, very important. If there is a recurrent bladder infection, or you are just somebody whom at any given point in time, you've got a bladder infection, you go get some citrus soda, you drink lots of water, it doesn't resolve, please do go and see the doctor. So what we do is we take the wee, we culture it, and we check which germs grow there and what are they sensitive to. So antibiotics are what we use to treat that kind of an infection. But we've got a cluster that does not respond immediately. Let me make an example of healthcare professional, an example of a lady who has just been discharged from hospital. Those people are not going to respond to the conventional antibiotics. So it's important to check that if you've got a recurrence of a bladder infection, where is the problem? If a bladder infection goes untreated, it will go up again to the pipes that supply the bladder with urine. Usually those come up, way up from the kidneys, they connect the bladder. If the infection goes up to the kidneys, you can have a very bad kidney infection. A bad kidney infection can result in a miscarriage. If you are pregnant, it can also result in formation of pus around the kidneys that will necessitate an operation to drain that. So bottom line, if you've got recurrent discharge, please know that it can lead to a bladder infection, and please know that a bladder infection can lead to a kidney infection, and a kidney infection is much more dangerous. It can even kill. It can also go into your blood. Once now you've got a blood infection that can lead you to have meningitis and all the other complications that are not within the scope of this discussion. So, what are we saying about discharges? Let me further break it down to say that discharges are also common outside the normal gynae patient to the obstetric patient who is now a pregnant patient. So what sort of discharges should a pregnant patient expect? I'm going to just dwell a little bit under that because we need to now know when should we press the panic button in pregnancy. First of all, if outside pregnancy, you've had an issue with discharges, when you are pregnant, please ask your doctor to do a swab. A swab is when now we get a specimen to test in pregnancy, is that still a problem or not? Let me make an example. There is an infection that's called Group B streptococcus. The mothers who've been pregnant will know, because now we've got a very much Googling audience. Pastors, the women are knowledgeable. So they call it Group B strep. Group B streptococcus is responsible for babies who die inside the womb. It's also responsible for babies who get, for mothers who get a recurrence of miscarriages. So if you have discharge outside pregnancy, then you need to be tested during pregnancy if you do not have that Group B streptococcus GBS. So if it is there, it can be treated early in the pregnancy, retested again, treated later in the pregnancy, just to make sure that the pregnancy goes smoothly. Secondly, we've mentioned also that during pregnancy, we are likely to see yeast infection, which is thrush. That can be treated. And please don't get offended if your gynae keeps on treating it every time you show up. It is better treated every time you show up than to hide that you have it. You should not have a leak during pregnancy. A leak during pregnancy is a danger sign. So sometimes you think that maybe I weed myself, or maybe if it is wee, it will smell wee. If it does not smell wee, you are not sure what it is, rather have it checked, because the risk of the baby's water bag breaking during pregnancy is also possible, and that will show as clear water. If your placenta is low-lying, it will show as a bloody discharge. So that is also not healthy in pregnancy. It must not happen. I've heard some mothers who say that I get a period-like discharge throughout my pregnancy. Please do see your doctor to make sure that the worst case scenario is avoided or is averted during the pregnancy. The other thing that we see during pregnancy will be a yellow discharge. That yellow discharge, sometimes it goes with the concentration of your vitamin C, of your vitamin B in your supplements. So the supplements that we take in pregnancy have got vitamin B. And vitamin B, when you go and pee, it will have a smell and it will have a color. So sometimes if your fluid intake is not balanced, you'll see your discharge a little bit more yellow. So please don't panic. If it is a little bit more yellow and it smells like hospital, then you know it is mainly because of the vitamins. I hope we are following, and I hope we are enjoying this, wonderful women of God. So in summary, may I say that discharges or infections are common in ladies, both in the non-pregnant state and also in the pregnant state. The ones in the non-pregnant state, they can be bacteria, they can be yeast, they can be the viruses. It is important that when you do your pap smear, you please ask for a screen of those discharges or those infectious agents that we've spoken about. It is going to help us to manage ourselves effectively. And where you have a suspicion, I said it in our previous talk, if you have a suspicion that your partner is not conducting himself accordingly, you are advised to seek intimacy with a condom. A condom is protective if it is used effectively or efficiently. And then in pregnancy, we still get a more or less similar trend, but now we add that in pregnancy, you should not bleed, or you should not have a brown stain discharge. You should not have a bloody discharge. You may have a yellow discharge, which can be because of your supplements that you're taking in pregnancy. You may also have recurrence of bladder infection. Please do have it treated because it can result in a miscarriage. It can result also in severe complications if you are pregnant and also non-pregnant. And then lastly, we are saying that where everything is confusing or you don't know what is happening, you can Google if you are Googling, but please seek medical attention. Medical attention where you can be able to talk to your doctor. Conversations are very important. Sometimes you may find that after you've been to the doctor just reassures you that this is common. And I have seen that with our younger patients, it tends to be common that they would want to know that I have had a discharge that is clear. I think that is not healthy. If you put things into perspective, then they get to understand their bodies a little bit much more better. So in summary, we are well-informed women. Let's get out there, seek help from our gynaes, seek help from our healthcare providers, and be healthy women. We have still a loaded sessions coming up. Please continue to join us on the amazing power of woman and get more information on our medical issues. Until we meet again, thank you so much, wonderful ladies, powerful, amazing women. Thank you.
Wow. We are so grateful, Dr. Gamedze, for your insight, for your expert knowledge. I hope you were helped. I hope you learned something from the things that were shared. Now you have knowledge. Please use the knowledge you have.
Yes.
If you need to see a doctor urgently, please let us know. If you are in Johannesburg, and we can send you the details of Dr. Gamedze's rooms so that you can call and make an appointment with her staff and then go and see a doctor. And if you are not in Johannesburg, there must be a gynecologist somewhere near you.
Also, if you have questions on what you've heard today,
yes,
we have an email address where you can send your questions to, and you will be answered. It's askyourgynae@gmail.com.
Yes, askyourgynae@gmail.com.
You can also send your questions there.
Yeah. All right. So we are going to call it off for tonight. Just another reminder about the conference.
Yes.
The Power of Woman Conference is happening on the 27th of August
on
a Saturday, and we do have a very powerful lineup of activities and speakers. This year's theme is the God-sufficient woman.
Amen.
The God-sufficient woman. All right. So we're looking forward to seeing you at the conference. But for tonight, God bless you. Good night. Enjoy the evening.